this is a very correct, a topic dear to my heart. And usually I actually spend a lot of time on this. I usually do 2 full-day workshops on this. So squashing all of this into an hour is definitely a challenge. And so it'll definitely just be like an overview today. But if you guys ever want me back in the Philippines and teach you the intricacies of it, you know, you just get me a plane ticket and I'll be here. All right, so organic acid testing. So let's get into it. I do just want to acknowledge Dr. Ben Lynch. He has given me permission for using some of his older pathway planners in a lot of my presentations, and it always makes it easier to illustrate some concepts. Just wanted to acknowledge him in the process. And this is just sort of like the lecture overview. I'm not going to go over that too much. So it's a short introduction to show you how to connect the dots and how to put the puzzle pieces together and how you can combine organic acid testing with blood chemistry and genetics. And like I said, there's a lot more to organic acid testing, but today I'm just going to give you the basics so you can see the potential of using tests like this in your chronically ill patients or where you are struggling to get to the bottom of what's causing their ill health. Because the reality is that people are getting sicker and sicker, and the usual things just doesn't work anymore. So we need to be able to zoom in, zoom out, look at the big picture, and treat the person as a whole and as the individual that they are. And I'll also tell you that the word protocol is a dirty word in my clinic. This approach may have worked 10 years ago where you could use certain protocols, but it's just not good enough anymore. Certainly not in the type of people that come through my doors, and I'm sure that's coming through your doors as well. So each person in my clinic gets a completely different treatment plan to the person before them. Right. Just going to see if I can... Oops. All right. So our job as clinicians is to be detectives. That's what we have to do. We have to dig deep into what's causing our patients' ill health. And the organic acid test is one way I do this because it's a biochemistry paradise, if you like that kind of stuff. And as you've seen yesterday, I do like that kind of stuff. And I've delved so much into this, and I still continue to do so, that it's earned me the nickname of the organic acid test whisperer all over the world. And I thought, okay, I'll go with that. So I'm here to sort of impart some of that knowledge to all of you and get you as interested and passionate about this test as I am, and also to help you understand better if you're already doing this kind of testing and how to interpret this test. So a quick introduction in the organic acid test. So what is the organic acid test? So as practitioners, we do a lot of different tests for our clients. And so what makes this test any better? Well, in general, I call it like the snapshot of the biochemistry in the body at that point in time, because that's what it is. It sort of takes a snapshot at that point of doing the testing and can give you a lot of valuable information about things such as how you metabolize neurotransmitters, how you produce energy, what your nutritional status is like, how well or not well you're metabolizing fats, how you are detoxifying, what's going on in your gut or in your digestive system, but also what's going on inside your cells. And so for a first entry-level test, it can actually give you a lot of information at the fraction of the cost. It's also a great test to order if you don't know where to start, as it often points you in the right direction after looking at most probabilities first. Now, there's also a lot of labs that do organic acid testing. So which lab is the best one? And I will just let you guys know, I do not get paid by any lab to sponsor any kind of tests. For me, I interpret organic acid tests from many, many different labs. And it really just depends on the markers that you want to test for, and also which panels you feel most comfortable in interpreting. So I just regularly use Great Plains because it's a very affordable test in Australia where I come from. But like I said, I also interpret a lot of Genova Nutrival tests. In general, they all give you the same information with just some slight differences here and there. Probably the biggest difference is the oxalate markers that you do get on the Great Plains test that you do not get on any of the other labs. But then, you know, on the Genova panel, you get things like the 8-hydroxy-2-deoxyguanosine markers and lipid peroxidation markers. So it really just depends on what markers you are looking for. All right. So to understand the organic acid test, you have to understand what it measures. So as we all know, it measures organic acids, but what is an organic acid really? So organic acids are defined as non-aminocarboxylic acids, and this includes compounds of carbohydrate, lipid, and protein metabolism and their catabolic intermediates. And so in other words, it's the food that we eat that are metabolized into smaller compounds that then undergo oxidation, where these chemical bonds are broken down or broken up, and then energy is released from our food. So along the way, we have all of these other metabolites that are produced, and that then gets dumped into the urine. And that is what we measure. And so if we are a little bit more specific, an organic acid is an organic compound with weak acidic properties. So when we break the food components down for energy, we form substrates, and then these substrates are then further broken down and used for growth, repair, the maintenance of the cells and the tissues. And in addition, the enzymes involved in these reactions, they also need vitamins and minerals as cofactors to function. So if we look at the top part of this image over there, we can see that when you are healthy and everything works as it should, then the nutrients from a healthy diet and a healthy digestion provides the cofactors for the enzymes to metabolize the substrates and the amino acids into products along the chain until the final excretory product is produced and the biochemical reaction is complete. Now, for all of this to happen, you need sufficient substrate, you need functional enzymes, and you need low interference. And so interference can come from anything such as vitamin deficiencies, but also from genetic SNPs or mutations, infections, environmental toxins, or even stress. All right. I'll just see if this is the same one. All right. Actually, I'll go back to there. So if we look at the bottom one there, so this is what will happen. You can see there's your substrate. Now you have an interference, and so that enzyme is not working very well. And so there's two alternatives that can happen here. First of all, the normal metabolite is not being produced, and then the substrate will find an alternate pathway. And this is sort of like what we will measure. We'll measure the end metabolites or the metabolites from an alternate pathway, and then it gives us clues as to which enzymes are inhibited and the reasons why. So essentially, when that goes wrong, in a test result, it will be reflected as either you will be able to measure higher levels of the substrate or higher levels of the alternate metabolites, or lower levels of the normal downstream metabolites. And if you understand this concept, then the rest is actually really easy in terms of interpreting the test. But before we continue, there are a couple of pitfalls just to warn you about, or just little things that you need to check to make sure that you are reading and interpreting the organic acid test correctly. And this is the stuff that no one tells you about, so, but it can make all the difference. So always check the age. I know it sounds silly, but markers are corrected for based on the age of the person. So make sure that the age of the person has been recorded correctly, because I've had test results come back and then they've recorded the age as 0, and obviously it skews the results. And that's just an error of them, putting the wrong age in. So just really check that, because it can affect how you're going to treat that person. The other thing that I like to do is I like to check creatinine levels just to determine how concentrated or dilute the sample is. So obviously labs check for this, and if it is too dilute, they will reject the sample and you'd have to redo it. But I like Dr. Kapoor, believe that there are narrow ranges that we should work in. So I like to work in between a level of 100 to 150. Then I know, okay, well, this is a pretty good sample. So if it's anywhere below that, then I may, I guess, question some high normal levels into whether they are really high normal, or should I be interpreting them as being over the range as well. Now, when you look at the nutrient markers, that you will notice that there's a little asterisk around some of them. And they do have the explanation here at the bottom, but the asterisk really means that you just read the results the other way around. So normally, if you see a low level like that, you'll interpret that as a low level. But if it has the asterisk and it's on the high end of the scale, then that will be a deficiency or a low level. So you just have to interpret it the other way around. There are also certain foods and supplements to avoid prior to testing. And usually the instructions are in the testing kits, which will give your client this information. But it is good to remind them or to even highlight it to them if you actually have the test kits in your practice. That's what I used to do. I used to take out the paper and just highlight which foods they need to avoid for about 24 to 48 hours before doing the test. And so you will see there that they say that 48 hours or 2 days before collecting the sample, it's a good idea to avoid apples, grapes, which would include raisins, pears, and cranberries. And this will include fruits and their fruit juices, and also superfood powders. Like a lot of people these days are taking superfood powders. So you just make sure that they are avoiding things like that 2 days before doing the test. But also things like green or black tea, due to the polyphenol content contained in them, can also sometimes skew the bacterial markers. 12 hours before, it's a good idea to avoid arabinogalactin, echinacea, reishi mushrooms, and ribose supplements, just because they can skew some of the results. The next thing you want to do is you want to make sure that they are getting and absorbing enough protein from their diet. Why? Well, because you need protein to make organic acids. So think about your vegans, your vegetarians, children who don't like to eat red meat and only want to eat white carbohydrates. There's lots of them. And then also think about older people with lower stomach acid content, or just even someone who is in a continually sympathetic state or dominant state, and they're not digesting their food properly. And so what I usually suggest here is either to have them take something like a protein powder or a combined amino acid powder for maybe about 1 week before doing the sample, if you suspect that they may not be absorbing their proteins very well. Otherwise, you get a result back where all the levels are low, and it doesn't really give you much information. And then last but not least, there is no such thing as a bad marker or a good marker. Your body is doing what it is supposed to do. So it is not your job to fix that. It is your job to understand why the body is doing or needing to shift its biochemistry in a certain way and fix that part of it. And that is actually much harder to do than to just follow a protocol. But that's how I like to view things. The markers are just there to tell you what's going on in this person's body. All right. So let's get started. So we all know by now that the human gut microbiome has a huge impact on brain health. I am going to focus a little bit on the gut aspect, on how it is measured on the organic acid test, but you'll also see towards the end that how this flows into the brain chemistry and changes within the neurotransmitter markers as well. And the reason why I'm going to focus on these things is, even though this is about how to use the organic acid test in terms of measuring mitochondrial dysregulation, if you remember, I talked yesterday about the cell danger response and what is the causes of that mitochondrial dysregulation. And the causes of mitochondrial dysregulation is a lot of time pathogens. So if we can measure pathogens and we can treat them, then we are in fact affecting change in the mitochondria as well. So the gut microbiome influences brain chemistry in several ways. Lipopolysaccharides from gram-negative bacteria stimulates the innate immune system. We spoke a little bit about that, and create low-grade inflammation. We also have bacterial proteins that can cross-react with human antigens and cause the adaptive immune system to behave inappropriately as well. Even bacterial enzymes that can produce neurotoxic metabolites such as D-lactate and ammonia. Beneficial metabolites such as short-chain fatty acids can also have neurotoxic effects depending on the receptors that it binds to and the quantities that it occurs inside the body. And then gut microbes can also produce hormones and neurotransmitters that are identical to those produced by us. And bacteria have receptors to these hormones, and then this can affect how virulent they become and how fast they grow as well. And then gut bacteria can also stimulate afferent neurons of the enteric nervous system to send signals to the brain via the vagus nerve, and in this way they can really disrupt autonomic nervous system function. And Clostridia is a prime example of doing that. So let's start with the bacterial markers first. Now, first of all, I'd like to get an idea. How many of you guys do use organic acid testing? Wow, only a few. How many of you know about organic acid testing? Okay, a few more. So I get that this is probably a test that not a lot of practitioners here use yet, but it is becoming a very, very popular test both in Europe and the US. And it's definitely one to keep in mind if you are treating chronically ill people. So I hope you're going to learn like how beneficial using this test can be, and maybe you guys will explore it a little bit more with your patients. So we'll start first with the bacterial markers. I will try to use different labs to illustrate many of my points where I can, because you'll probably get exposed to different lab results, and you will maybe want to also decide which lab will work really well for you, because trust me, it's the same markers. It's very intimidating when you look at one of these tests and you look at another one, you think, but this is a completely different test, and it's not. The markers are exactly the same, but they're big names, and so it can be a little bit intimidating. So these are the bacterial markers on the Great Plains organic acid test. And so the bacterial markers will commonly show up. You'll see that they even have the heading there, bacterial markers, so it's very easy to find. But this will come up with intestinal bacterial overgrowth, which can be found in the gut, as well as other disorders such as cystic fibrosis, celiac disease, or short bowel syndrome. And they're generally produced from unabsorbed phenylalanine or tyrosine, which are both essential amino acids. And then these amino acids are degraded by intestinal bacteria into these different compounds, which is then what we measure on the organic acid test. So hyperic acid, which is the one that I highlighted there at the top, that's probably the most common marker that comes up with gut dysbiosis associated with bacterial overgrowth. And pretty much what happens is when bacteria break down polyphenols or dietary polyphenols, and polyphenols is just substances you get in a lot of fruits and vegetables and tea and things like that. But then they produce benzoate or benzoic acid, which is then conjugated with glycine in the liver. And so dietary phenols are things such as quinic acid, which is found in foods such as green or black tea. And these can often persist in the lower small intestine. And when they are not, and that's the reason for that is because some of these polyphenols are not broken down very well by the digestive fluids in the gut. And so if these dietary polyphenols hang around, then it gives bacteria the opportunity to metabolize them and then produce benzoate in the process. And that gets conjugated and then forms hyperic acid. And so here are just three different results from two different labs. So we've got the Genova Nutrival, that's the Genova, no, I think that's the Metamatrix Organics one, and then that's the Great Plains one. But this is just to show you it's the same markers. It looks different, but it is just the same. So let's look at the Clostridia markers for a second. So again, they do have it under a heading that says Clostridia markers, so it's not like you have to go and memorize these markers. It all gets categorized for you, and you know where to sort of like focus your attention. But the Clostridia markers are usually paired together with the bacterial markers. You'll see there's the bacterial markers. So they're sort of like paired together there. And this is pretty much where you will find them on the Great Plains laboratory organic acid test results. And then if we blow them up a little bit more, I just took that out and blew that up a little bit more. That's what they look like. And you'll see that they have very fancy names such as 4-hydroxyphenolacetic acid, HPHPA, 4-cresol, and the 3-indolacetic acid there. So when we look at the Genova Nutrival test, we can see that they do not measure the more distinct 4-cresol and the HbA markers associated with C. difficile or Clostridia difficile, but they do measure these other markers. And the 4-cresol marker is a very, very distinct marker for Clostridia difficile. So usually when you see that marker on a panel, it may sort of prompt you to test for the toxin A, toxin B that's commonly associated with Clostridia difficile. And this is just the Clostridia markers seen on the Metamatrix Organics panel. So there is a close relationship between Clostridia overgrowth and dopamine metabolism. This can be measured on the organic acid test, and it's a very important factor, especially when dealing with the autistic community, where this is quite prevalent. I know that you guys are probably more into anti-aging and cancer treatments, but I mean, autism is on the rise, and this is a very common issue that we see in autistic children. And it pretty much brings us back to that brain-gut connection, where we all know that what happens in your gut affects what happens in your brain. And so if we look at this is on one of Dr. Ben Lynch's pathway planners. It looks very, very complicated. But you can see that if we look at more of the neurological effects of the Clostridia metabolites, then HbA and 4-cresol, they can actually both damage this dopamine beta-hydroxylase enzyme, which is right there. And then those two phenolic compounds, which is the 4-cresol and the HbA, they are produced by these Clostridia bacteria. So what they do is they bind to the dopamine beta-hydroxylase enzyme, which then allows dopamine to accumulate, and then norepinephrine and epinephrine levels to drop, because dopamine has to be converted into norepinephrine and epinephrine down this chain of events. But now you get this inhibition happening right there, and that then does not happen. And so what will happen is you'll see increases in the HVA and decreases in the VMA markers, which is the dopamine and the norepinephrine markers on the organic acid test. And so that's just because of that disruption there. So everything down here will decrease, that will increase, and then you can see here that it finds an alternate pathway down here, and that's the metabolite that will increase, that you will then measure on the organic acid test. And this is pretty much what it will look like. So you can see if dopamine metabolism is being interfered with, it takes that alternate pathway. So HVA or homovanillic acid starts to increase. You can see a really high level there. And your VMA, which is your norepinephrine epinephrine marker, will be normal or much lower. And so it's that ratio discrepancy that you're looking for. So even though that's normal, you're always looking at the ratios, because that tells you that there is an inhibition there. And then also remember that norepinephrine, it is a very, very important neurotransmitter because it is involved in short-term memory. And it's one of the key areas affected in the cerebellum when we look at Clostridia and autism. But as we know, nothing ever happens without consequences. So when you have this dopamine accumulation and then things not being converted down to norepinephrine and epinephrine, it pretty much leads to autonomic nervous system dysregulation and then activation of the sympathetic nervous system, which then may contribute to signs of depression, anxiety, insomnia, irritable bowel, because you have the situation of neural excitation or overstimulation where everything is firing, but you don't have the inhibition to keep that under control. And we see a lot of this in our patients. And in some of the symptoms that you can see with this, with Clostridia, it's been associated with things like schizophrenia, psychosis, depression, chronic fatigue, tics and even Tourette's syndrome, autism, ADD, ADHD, autoimmune disease, rheumatoid arthritis, OCD-type behaviors, seizure disorders, and also gut symptoms, diarrhea, and constipation. So you can see that an organism such as Clostridia can have a huge effect on the neurological system and the cell signaling that happens there as well. And so in summary, this is how bacteria in our body will produce chemicals such as cytokines and chemokines that then stimulate the vagus nerve to secrete acetylcholine and other mediators. And then these in turn will go and sit on receptors of the hormonal and the neuronal system and influence neurotransmitter and hormone production, which then have immunomodulatory influences because the immune system, the hormones, the neurotransmitters are all linked together. And so in turn, the immune status of the host will then also affect the microbiome. So everything is connected. We're not just dealing with a gut, we're not just dealing with a thyroid, we're not just dealing with the brain. All of these things are connected with each other. And like I said, this is also known as the gut-brain neuroendocrine axis, and just illustrates how the gut, the neurotransmitters, and the hormones are all interlinked with each other and the immune system. And we did have this slide yesterday, so about microorganisms and how they can manipulate biochemical pathways and create dysregulation in mitochondrial function. And like I said, Clostridia is one of those organisms. So what happens is Clostridia robs the cell of acetyl-CoA and pyruvate, which is the entry point here into the TCA cycle for energy. And then it causes like a significant inhibition of complex 1 in the electron transport chain, because now less NADH is being produced on this side, because you're pretty much just cutting that whole cycle in half. And then also you have the propionic acid that's being produced by the Clostridia bacteria, sort of like short-circuiting, entering here as succinyl-CoA, which then inhibits the activity of that isocitrate dehydrogenase and the alpha-ketoglutarate dehydrogenase. And like I said, it is a propionic acid-producing bacteria, which can then feed into the TCA cycle, so that's succinyl-CoA. And remember that short-chain fatty acids can also, produced by gut bacteria, can have neurological effects, and that may not be so favorable. And so propionic acid is one such an example. Carnitine is usually used to remove excess propionic acid, and in this way, Clostridia overgrowth can also actually rob the cells of carnitine and affect fatty acid metabolism. And Dr. Levy was talking yesterday about carnitine being an essential nutrient for the mitochondrial function. So you can have these organisms robbing the cells of these products that are needed for long-chain fatty acid metabolism. And in fact, these are some of the neurological symptoms that have all been associated with higher propionic acid levels that is found in Clostridia bacteria. So things like your ASD type behaviors, altered social interactions, tics and hyperactivity, reactive astrocytosis in activated microglia, and then also epileptiform like spikes in the hippocampus, the neocortex, and the basal ganglia as well. So everything needs to be in moderation. When there's an excess production of something, it'll have a consequence on other systems in the body. Some other abnormalities that you can often also see is, like I talked about, redox molecule imbalances from what we talked yesterday, but also abnormalities in your phosphatidyl ethanolamine levels, which is a sort of like has a huge effect on neurotransmitters, can have effects on mitochondrial dysregulation, acyl-carnitine deficiencies, and also altered carnitine metabolism. Now, the Clostridia markers that we measure on this organic acid test, which is your 4-hydroxyphenylacetic acid, your HPHPA, and your 4-cresol, they are all 3 phenolic compounds, and they are PST inhibitors. So what is PST? Well, PST stands for PHENOL-SULFUR-TRANSFERASE enzyme, and this enzyme is found in the small intestine, and it is involved in the metabolism of phenolic compounds, amongst many other compounds, as you can see here on the left. So this little enzyme has the job of metabolizing things like acetaminophen or Panadol, phenol, salicylates, amines, catecholamines, which is all your estrogen and your stress hormones, your estrogen, serotonin, norepinephrine, epinephrine, Clostridium metabolites, and bacterial metabolites. That's a lot of stuff that this little enzyme has to do. So if you now have Clostridia bacteria, and which are huge phenol producers, or at least they produce byproducts that have similar biochemical structure to phenols, then what do you think is going to happen to this little enzyme? It will slow down, or it will become overburdened by all of the jobs that it needs to do, which will mean that a lot of these compounds here are not going to be able to fit through that little door and be broken down. And so because when you have too many things that has to fit through this little door, which ones do you allow through and which ones do you not allow through? And this is where the expression of many genes and their enzyme functions can actually come into play, and why not everyone is going to display the same degree or even similar symptoms. And so to a large degree, the clues lie in the symptoms. So if you take a very good case history, as you all should be doing as functional medicine practitioners, then you can determine which products are actually not being metabolized through this enzyme, and that's producing the symptoms in your patients. So for instance, if salicylates or amines are not being metabolized, then your client's going to have the typical red ears, red face, or the salicylate intolerances. If they're not metabolizing their hormones down, they're going to have estrogen dominance, etc., etc. If they, not metabolizing things like the like acetaminophen down, that can create drug toxicity issues because they're not breaking these drugs down effectively. But this is where questioning your patient, you can start determining which ones are not being metabolized. Because a lot of those compounds have alternate pathways to be broken down, but then it'll just depend on how well phase 2 liver detoxification is working and other enzymes. And so, for instance, when that PST enzyme is not working very well, you'll often find the 2-hydroxyhyperic acid marker on the organic acid test elevated, because this is an indicator of excess phenolic compounds that now has to be processed by the liver due to the slower function of this PHENOL-SULFUR-TRANSFERASE enzyme. And so then you'll start to see this one elevated as long as they have enough of that conjugation system on board. So it is common to see it elevated, but usually not by much. I mean, if you start seeing it elevated in very large quantities, that definitely indicates that there is pressure on that phase 2 liver detoxification system. And so phenols are just one of the markers that we can measure in gut dysbiosis. Whenever there is gut dysbiosis, we get metabolites that are produced as bacteria create shifts in our biochemistry. And so they can create things like ammonia, phenolic compounds, as we've just talked about, lactate, both D-lactate and L-lactate, and also propionic acid. And these are just some of the bacteria or organisms that produce these substances. But all of these substances can cause mitochondrial dysregulation. So if you get rid of the organisms that produce these substances, then you can correct the mitochondrial dysfunction. And the beauty is that on an organic acid test, you can actually measure these markers, and so it starts giving you an idea of what is causing the mitochondrial dysregulation and then how to treat it. So we already looked at the phenol marker, which was that 2-hydroxyhyperic acid marker. So let's look at the orotic acid marker, which is another marker on the organic acid test. So it's sort of like classified, you'll see there as under ammonia excess. Technically speaking, orotic acid is not just an ammonia marker, it's also a folate marker. But no, I'm not going to try and confuse you too much today. So we'll just talk about it as an ammonia marker. So many bacterial and parasitic organisms are producers of ammonia. And some examples include H. pylori, Bacteroides, bifidobacteria, Clostridia, Proteus species, and also Klebsiella species. They can all produce ammonia because they possess urease activity, which gives them the ability to deaminate proteins in the large intestine and then produce ammonia in the process. Now, ones that seem to be more active in ammonia production are the gram-negative aerobic bacilli, such as E. coli, Klebsiella, Proteus, and Pseudomonas species. And it's not commonly seen elevated on the organic acid test, although I do see it elevated quite a bit. So it'll really just depend on your patient population on whether this is something that you'll see a lot of. All right. So ammonia is a highly toxic substance, and it can produce symptoms even in tiny amounts. And so it's very important for the body to neutralize it and clear it out as quickly as possible. And some of the symptoms that you may see with ammonia accumulation include things such as anorexia, irritability, heavy or rapid breathing, lethargy, vomiting, disorientation, somnolence, asterixis. And asterixis is sort of like a flapping tremor. So they call it a flapping tremor because it resembles like the flapping of a bird's wings. combativeness, obtundation, coma, and also cerebral edema. Obviously, these are very extreme symptoms of excess ammonia, and you're not likely to see these kinds of symptoms in your clinic because they are a lot more serious, but you're more likely to see things like fatigue, brain fog, and nausea symptoms, which is very common with excess ammonia. Now, there's a couple of theories going around about why ammonia is so toxic and why it produces these kinds of symptoms, with some claiming that it may be actually mimicking potassium ions and then getting into areas of the biochemistry where it shouldn't be. But, you know, I don't know. There's probably a few reasons why it causes symptoms. Now, we also have mold markers on the organic acid test, which is, as far as I'm aware, is just measured by Great Plains Laboratories at this stage. And this is what the mold markers looks like. So it's those three there that I've highlighted there. And mold is a huge trigger for inflammation. I mean, environmental mold exposure is linked to a condition called CIRS. For those of you who do not know what CIRS is, it just stands for Chronic Inflammatory Response Syndrome. It's something I was interviewed like a while back. So if you want to learn a little bit more about it, you can always go to that link and listen to the interview. But it does bring us to the question of what do the mold markers really mean? Like, are the mold markers on the organic acid test a measure of environmental mold? Well, not necessarily. It is not a definitive marker for CIRS biotoxin-related illness. So don't rule that out as a possible root cause factor if you don't see those mold markers elevated on the organic acid test. I've seen many biotoxin markers come back positive when there was no elevation on the markers on the organic acid test. So if you suspect mold biotoxins from the environment, then it would be better to do tests such as this one, for instance, which is it's another urine one that measures some of the mold biotoxins there, and also maybe other markers that are indicative of possible mold biotoxin illness, such as C3A, C4A, TGF-beta1, or measuring the mold toxins more directly. So this is closer to what the mold markers on the organic acid test mean. It is more commonly coming from the exposure on moldy foods, such as fruits, grains, cheese, old nuts, dried fruits, or peanuts. And usually these markers will come down when the foods are identified and eliminated. And something that you really have to be careful of is things like nut butter, so peanut butter and things like that, because they use the old moldy nuts to grind them down because you don't see the mold if it's ground down. And it's the same with the tomatoes. If you look at commercial pasta sauces, commercial tomato pastes, they use old moldy tomatoes to make those products. So that's corn chips is a very, very common one, as well as a lot of grains that get very moldy in storage. So sometimes you just have to identify the source, eliminate it, and the mold markers return to normal. So let's go to the Candida markers. Now these are the main Candida markers that you usually will find. That's tartaric acid, and that is the arabinose marker right there. So arabinose is elevated in about 90% of organic acid tests, and tartaric acid will show up maybe 10 to 15% of the time when there is a Candida overgrowth happening. Now the level of arabinose can sometimes be deceiving in clinical situations. So a high level doesn't always mean that your patient is going to have more symptoms. And similarly, a low level does not necessarily mean that the patient is going to be less affected, because some people have yeast sensitivities. And so even like a small amount of yeast, they may have more pronounced symptoms than someone else. So always go by clinical presentation. Something else that I've also noticed is that when sometimes we find low levels of Candida markers on the testing, yet they have all the classic signs of Candida. And that can sometimes be because of biofilm formation. So as soon as we disrupt the biofilm and we retest, we have the Candida markers come up much more, much higher. So there can sometimes be reasons for that. But it can give you like a good indication of how long treatment is going to take, based on how high the markers are, so how long it's going to take for you to get those markers down. And there are many secondary implications of Candida overgrowth that we, unfortunately I can't get into all of them today, but you can see there Candida can cause a lot of collagen destruction, which will include the skin and the joints and the bones and all of that. It can also cause beta amyloid plaque associated with Alzheimer's disease and dementia. It's also obviously implicated in biofilm formation. Also HPA axis disruption through inflammation and through the production of interleukin-6, which is a huge inflammatory marker that creates or that influences the HPA axis. And then oxalate formation as well, which brings us to our next topic, which is oxalates. The oxalate markers is something that I really look for on a lot of organic acid tests because it can cause a lot of problems. So these are the oxalate markers on the organic acid test, and you will notice that there's 3 of them there, which can be a little bit confusing at first. But pretty much the oxalic acid marker, which is the one here at the bottom, you will see that one elevated most of the time between those 3 markers. And usually the reason is either because of a dietary factor or because of gut origin. The other 2 markers, which is your glyceric and your glycolic acid, they become elevated when there are more other things going on, such as genetic SNPs or mutations that are being expressed, or when the enzymes involved in these reactions are compromised for some reason. It's less often that you will see these ones elevated, but you will see them elevated from time to time. And the 2 enzymes that's involved in these reactions contributing to glyceric and glycolic acid formation is your glyoxylate reductase and your alanine glyoxylate aminotransferase, and they're both dependent on vitamin B6 as a cofactor. So it makes sense that if you see these markers elevated, that you do want to be looking at the vitamin B6 marker, which is this one here, in conjunction to see if it's low. And you can see in this test result, it is testing a little bit lower there. And oxalic acid is one of the most acidic organic acids found in body fluids. They're pretty much dicarboxylic acids that cannot actually be metabolized down by mammals. And they are the ones that tend to form calcium oxalate crystals in various organs that can then cause damage to the tissues. Now, and this is because they actually have very sharp features when viewed under a microscope, which may irritate and inflame the surrounding areas. And so you can see on here, this is a live blood analysis. That's an oxalate crystal right there. And it almost looks like a little piece of glass, like a sharp shot of glass. And that can explain why a lot of people experience so much discomfort when these little crystals start to become mobilized in the body tissues because they produce a lot of inflammation as they move through the tissues. Now, from a molecular perspective, oxalates contain a hydroxyl and a carboxyl group, and by removing 2 hydrogen molecules, it becomes a negatively charged anion, which then attracts minerals like calcium to then form calcium oxalate crystals. And as we'll see, they can also bind to other anions as well. But this effectively neutralizes the negatively charged anion to become a salt, such as a calcium salt. So it's just a natural attraction between positive and negative ions. Now, probably the best known consequence of oxalate crystal formation is that of kidney stones, where calcium oxalate ions bind together to form insoluble complexes that can then get stuck in structures, and then they can grow larger and larger if left untreated. And this is an example of a staghorn crystal in a kidney tubule. So pretty nasty stuff. And like I said, oxalates are very strong binders to minerals and metals. And so this is a representation of the solubility factor when it comes to oxalates binding to minerals and metals. And you can see that metals like cadmium, mercury, lead is over there. They are less soluble. So they're on this like less soluble side of the list, whereas your minerals such as your zinc, your calcium, your magnesium are on the more soluble side of the list. And so it's in fact this solubility that is the factor that determines oxalate and heavy metal toxicity. So the less soluble the complex is, the more toxic it is. 15 minutes? Oh, I'm going to have to rush through this then. All right. So if the diet is high in oxalates but it's low in minerals, then free oxalates will be allowed to be absorbed into the bloodstream, bind to minerals or bind to metals, and then hold them in the body instead of excreting them. And something that's really important is that metal ions do not exist in isolation. They will attract negative ions, such as dibasic oxalates, to balance the positive charge of the metal ion in order to produce neutral complexes. So, in fact, the oxalates binding to heavy metals is kind of a protective mechanism that your body has to try and neutralize or to keep the metals from damaging surrounding tissues. But the problem is that oxalates is an extremely strong binding agent to the same extent as EDTA. So you can imagine if you have oxalates in your body and it binds to heavy metals and it's a strong binder such as EDTA and it locks it in your body, it becomes very hard to get rid of heavy metals when they are bound in these complexes. But that's the body's protective mechanism to stop the heavy metals from becoming damaging. And so where do we find oxalates from? Well, it can be found, like I said, from dietary sources such as spinach is very high, soy products are very high, nut products are very high. It can also come from fungal species such as mold and candida through an alternate metabolic pathway, which can then produce oxalates as well, and also through cellular metabolism in the hepatocytes or the liver cells. All of this can contribute to it. And as I said, it cannot actually be metabolized by us, like we don't have the enzymes to actually break oxalates down, but we have bacteria. Now, if we have a healthy gut microbiome, we have bacteria that possess these enzymes such as oxalate oxidase and oxalate decarboxylase, which breaks oxalates down. But now what happens if we've had triple antibiotic therapy for Helicobacter pylori infections, et cetera, we destroy those species. So now we don't have the bacterial species possessing these enzymes to break down oxalates. And so now we end up with oxalate issues later on. And because I'm going to rush through things, this is just a list of where oxalate crystals can form. They can form anywhere in the body, not just the kidneys. And these are just some of the symptoms of high oxalates, which you can read through later when you get the slides. And so apart from the fact that Candida can contribute to collagen breakdown, the arabinose can also produce cross-linking of proteins, which can then disrupt collagen synthesis. And we can really see how Candida and oxalates can contribute to a lot of inflammation in the body. And so let's look at, see how quickly we can go through the mitochondria aspect of this as well, because we do want to have a bit of a look at that. And I'm not going to go through this slide again. We did discuss that yesterday just about energy metabolism. But if you remember energy metabolism, this is how you will measure it on the organic acid test. So you have your glycolysis over there, your glycolytic cycle markers there, which is your lactic acid and your pyruvate. And then you have your Krebs cycle or your TCA cycle markers over there, which is your citric acid, your aconitic acid, your 3-oxoglutaric acid, succinic acid, fumaric acid, and malic acid. So you can actually measure all of your mitochondrial or your Krebs cycle markers on this test. And this is just the same markers on the Genova and the same markers on the Metamatrix test. So in a nutshell, it means that, carbon skeletons from food becomes broken down into carbon dioxide and water and produce ATP along the way if we look at the mitochondria or the Krebs cycle. And this is called anaplerosis, and it occurs in non-dividing and resting or non-stressed cells. So all they are really doing is they're making energy and they're breaking down food. But it's when the cell becomes stressed, either due to the cell danger response, as I've talked about yesterday, or due to the lack of oxygen or lack of nutrients, that shifts away from normal food and energy metabolism, which then affects how we burn fuel, how much energy we have in the sense of well-being, but also how much energy our organs have to function properly. Because remember that ATP or energy production is more than just adrenal energy in making us feel good. It is also energy for every single cell in our body, which includes the liver cells, the kidney cells, the pancreas, the brain, our immune system. In fact, our immune system uses the most ATP in the body. So how well that mitochondrial cycle is working, or that Krebs cycle is working, will affect how well do we detoxify, how well do we maintain our blood sugar levels, how well do we concentrate, learn, and sleep, and also how effective is our immune system in dealing with pathogens. And so before we finish on this mitochondrial section, this is how I want to show you what the cell danger response looks like in context of the organic acid test. And so this is a typical pattern of a cell danger response. So there are many, many different patterns in a cell danger response. And when you get really good at it, you can start looking at the patterns, and it really tells you, am I dealing with heavy metals? Am I dealing with viral infections? Am I dealing with cell wall deficient bacteria? You can start getting a lot of little clues if you understand the mechanisms of a lot of these organisms. So this is just one pattern, but it's a very common one that you'll see. And so you can see here that the mitochondria has two major roles. It has a cellular defense role, which is its biggest role, and then an energy aspect. The energy role is really just the secondary role. And what can happen is the cells can switch between glycolytic energy production or Krebs cycle energy production. So in this case, you can see that this is definitely very, very much an upregulated glycolytic pathway. You can see that lactic acid levels are huge, 166, where the pyruvate is very low. So all that pyruvate is just being shunted down here to lactic acid. As a consequence, you'll still have activity here, but you can see you've got like the zigzag pattern. It's like high, low, high, 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 very high. And so the succinic acid marker here, for instance, is an indication of a complex 2 inhibition. And so you can start reading the patterns like that. But when you start seeing them all over the place, then you know there's a cell danger response going on. And then it's like, okay, how do we investigate this? What's causing this? Which brings us to this point, that what is it that can activate that cell danger response and that can create that pattern that we see on the organic acid test? So it can be anything from chemical or physical exposure, such as heavy metals, heat, salt, shock, radiation, trauma. It can be microbial in origin, such as parasites, bacteria, mold, and fungi. But it can also be psychological. I don't want you guys to ever forget about the psychological aspect, because things like yelling, abuse, PTSD can also trigger the same kind of pattern as viruses and bacteria can do in the cell. But this is where you, as a functional medicine clinician, need to investigate and treat to have these mitochondrial markers restored back to normal and for energy production to get back on board again. And so I just wanted to, before I finish, to remind you so that if you do want your clients to get well, it is very important to treat from the foundation. So even though we're all looking for the next best supplement, the next best thing, the next best treatment, don't ever forget about the foundations. Because if you don't do the foundations, clean water, clean air, clean food, good exercise, stress-free environment, well, there's no such thing as a stress-free environment, but you know what I'm getting at. If you forget those basic things, then no supplement in the world is going to get your clients better. So just never forget about the foundations, even with all of the wonderful inventions that we have now at our disposal. So thank you, that's me. I do have my website, oatcourses.com, where I've got one course on there thus far, but we'll be putting more courses on as I'd like to educate clinicians more about how to interpret this test. One tip, though, is I will let you know the very first thing you do when you get an organic acid test result back of your client is you take the back end, which gives you the interpretation, you tear it off and you throw it in the dustbin. Because that's not going to get your clients better, following like a whole bunch of, because all they really do is they tell you, take these supplements, and that's not how you should be interpreting that test or any test result for that matter. You should be looking at ratios, you should be looking at their symptoms, you should be seeing how things correlate, because tests can be erroneous as well. And so, we have to start using our brains here a little bit and our common sense in interpreting a lot of these test results. But thank you very much.